Yeah, I think that these studies are still very early. The numbers are small. We're going to have to wait probably a year or two for them to accrue more patients and to mature to see whether these early results are going to be sustainable. We're definitely going to need to see what happens in the patients who do stop therapy. Do they maintain their remission, and does it remain MRD negative? Do they become MRD positive again? And so I'm not quite sure whether this combination will achieve immediate approval because it's not yet clear that the FDA is quite ready to use MRD as an endpoint for clinical trials. I think that it's moving in that direction, particularly for indolent diseases like CLL, where it's hard to do a study looking at progression-free survival or certainly overall survival as an endpoint because those studies just take too long. But I think it remains to be seen whether the agency is really ready to approve drugs based on an MRD primary endpoint. And so I'm not quite sure about that. Now the field will move beyond where the studies go and certainly beyond where the FDA label goes. And many practitioners may try and do combinations if the studies look favorable, even if they don't have FDA approval for combination therapy. There will obviously be some restrictions based on the payer and whether that's going to be financially supported. But I think that there's going to be some clinical use.